WhatsApp now to the displayed number for complete study material and other queries. Doctor decides to insert a ventriculoperitoneal (VP) shunt to 6-month-old infant. When exhibiting the procedure to the parent, the nurse should mention that a catheter will be surgically inserted from infant's brain to his heart to drain excess CSF. B. The prognosis is excellent and the shunt is permanent. C. Hydrocephalus is self-limiting by first year of age and then the shunt will be removed. D. The peritoneal cavity provides a large space for CSF absorption. Which of the following condition is the most likely cause of melena? A. Anal fissure. B. Hemorrhoids. C. Colorectal cancer. D. Peptic ulcer disease. The mother carried her week-old newborn into the clinic for the first postpartum checkup. Which of the following statement made by the mother require further education? A. The baby has a faint rash on her arms. B. The baby has not had a bowel movement in 2 days. C. The umbilical cord stump has not fallen off yet. D. The baby weighed 7.5 pounds at birth and now she weighs 7 pounds. A nurse is caring of patient with a peripherally central catheter PICC inserted into the right antecubital vein for first time. What should the nurse do before giving medication? A. Aspirate the PICC line for flashback blood return. B. Flush the PICC line with lidocaine to decrease pain. C. Ensure that placement has been confirmed by a chest X-ray. D. Sterilize the post with povidone iodine betadine. The patient with emphysema has gained 2 pounds in the 2 days since admission. The patient also has cyanosis and peripheral edema. What is the most likely causing these symptoms? A. Cor pulmonale. B. Pneumonia. C. Left-sided heart failure. D. Respiratory acidosis. A child is 14 years old is having a mole to be removed from his lower back. In day surgery, what is the nurse's legal obligation? A patient is too young to make an informed decision. B. The age of consent differs according to government law. C. Patient can give verbal consent without his parents being present. D. The doctor or nurse can sign the legal consent for a child. Patient came to her with heat stroke. What would arterial blood gases be most likely to? A. Metabolic acidosis. B. Respiratory alkalosis. C. Metabolic alkalosis. D. Respiratory acidosis. Female patient complaining of severe aching in her right lower leg. Her right lower leg was amputated a week ago due to gangrene diabetes mellitus. The nurse explained to the patient that A. She is experiencing phantom pain, which is often the case following this of surgery. B. This is impossible, as right lower leg has been amputated. C. She will call ERN to administer an analgesic to her. D. This is a normal occurrence following his type of surgery and will disappear. Which of the following statement is true regarding the transmission of typhoid fever? A. It is an airborne and masks should be worn by all contact with the patient. B. It is most commonly transmitted by the ingestion of food or water contaminated by feces or urine. C. Patient with typhoid fever should be placed in strict isolation. D. Contact precaution should be followed as the infection causes open sores. Nitroglycerine administered as a part of the pharmacological therapy for an acute myocardial infarction to A. Prevent heart attack. B. Increase cardiac work. C. Decrease venous returns. D. Relieve coronary occlusion. WhatsApp now to the displayed number for complete study material and other queries.